osteoarthritis, wear and tear arthritis, is the most common form of arthritis that I see in the hand, and it's essentially the joint cartilage is wearing away as you continue to use your hand. It's very similar to the tire tread on your car, where as you continue to drive, you wear the tread away. Surgical reconstruction, when patients finally meet criteria for surgery, and that is that the cortisone injections don't work any longer, the topical medications or the oral medications stop to work, or they lose function in a specific type of activity that they either need to do or they want to do. Then they meet criteria for surgical intervention. And surgical intervention for arthritis of the hand basically comes into two main categories. The first is a fusion. You remove the joint and you connect the bones so that there's no joint there any longer. And that's most commonly done for arthritis at the very tips of your fingers. The joints are fairly small, and the artificial joints that are made won't tolerate the type of stress that's created by pinching. But the thumb, especially the base of the thumb, can be reconstructed with what's called an arthroplasty, which is, arthroplasty basically means reconstructing the joint. Most surgeons are still using a tendon graft from your forearm to help reconstruct the joint, and that's the type of reconstruction that I'm currently using, and that has the longest track record of success. To perform the fusion of the DIP joints, usually we use a screw that enters from the tip of the finger and connects this bone here at the tip to the next bone up, the distal and the middle phalanx. And so the screw goes in through a small hole at the tip of the finger and goes across the bone. The screw is completely inside both bones. There's no screw head or any other prominent hardware on the outside that would cause pain if you were trying to pinch or use your fingers. It's all internal to the two bones. That's what's used for these joints at the tips. The PIP joints, the index fingers, are usually fused. The middle and ring fingers can be replaced, but to do the fusions of your index finger, you can either use a screw similar to what was used for the tip, or sometimes you have to use wires, and the tips of the wires would have to necessarily stick or protrude out from the bone. And sometimes when people use their index finger, they have discomfort from the wires. So after the fusion is solid, we'll go back and take the wires out. Post-surgery rehabilitation of the hand after these types of reconstructions is required in almost every patient. There does need to be a therapy protocol that's initiated. If you have a fusion performed, you have to wait till the fusion is solid and the bones have healed together. On average, that's 6 weeks. It could be longer or it could be shorter depending upon patient factors. But after the repair has healed, therapy would need to be performed so that you can restore your strength and your motion and your function. I chose to go into orthopedics for a very personal reason. When I was in 7th grade, my father, who worked construction, was critically injured in a fall and had to have about 8 operations, all orthopedic operations, and some neurosurgery operations on his neck, and was within inches of his life at one point. And through the orthopedic surgery that he had, through the orthopedic surgeons that cared for him, as well as the therapists that also treated and rehabilitated him, he was able to get back to normal function. Wasn't able to return back to construction because he had too much damage to his leg and his wrists, but he was able to go back to a reasonable function. So I chose to go into orthopedics for that reason. Why did I choose hand surgery as a specialty? As a friend of mine recently mentioned, I seem to be a bit of a perfectionist, and that's very true. And in hand surgery, the tolerances are very tight. We usually work on the order of less than a millimeter of variability in terms of what we'll accept for for what's adequate in a repair. That's much different than hip or knee, where you're usually working on the order of 5 millimeters or so. So with that type of tolerances that's required for good outcomes in hand surgery, and being a perfectionist, it was a natural fit for me to go into hand surgery.